Hello, I'd like to welcome you to the lecture today. Today I'll be talking on exercising with chronic pain on behalf of the Chronic Pain Center. So why are we talking about exercise with chronic pain? Usually it's one of the last things that people want to discuss when they're in pain. They think about exercise and they think about increasing their symptoms. They think about causing themselves a flare-up. But really, when we look at the research, exercise is one of the most important parts of a pain management strategy. And so what we're going to do is we're going to look at why this is in the first part of the slideshow here. So when you look at the literature that's out there, most studies that review exercise and chronic pain show that it is an effective treatment. It may not be something that takes away your pain symptoms, but it's something that has a positive benefit on how you function on a day-to-day basis. So let's look at a few of those things right now. First off, we know with exercise that there are just general health benefits. We know that anybody who's exercising is going to have a better health situation. So when we look at just exercise in general, exercise can help prevent any concurrent medical conditions from occurring. What I mean by that is it can help prevent the onset of other things like heart disease, like diabetes, these things that do come from a more sedentary type lifestyle. So if we can prevent these illnesses from occurring at the same time we have our chronic pain, of course that's going to help our overall health situation. In general, we know that exercise helps to improve our cardiovascular health. That's improving our ability to transport oxygen to our body, which helps our working muscles, which helps us to have more endurance on a day-to-day basis. It also helps to improve our strength and endurance, so it helps improve our ability to use our muscles to do the day-to-day tasks that we need to do on a daily basis. And it also helps to maintain our range of motion, our flexibility, help keep our joints from becoming stiff and sore after we have done the other activities that we're taking part in. And so overall, we just want to maintain just our general health benefits by staying active. Another benefit from regular exercise is enhancing the quality of sleep. Something I hear quite often when I'm working in the clinic is that individuals with chronic pain do have disturbed sleep. They're not able to maintain their sleep throughout the night. They're unable to fall asleep. What's been shown with a few studies is that exercise can get someone back onto a regular sleep pattern. A couple reasons for this. Number one is if you're exercising, generally you're expending a little bit more energy, which leaves you a little bit more tired at the end of the day, which helps you to fall asleep. Another thing that's been pointed out is that if you time your exercise during the day, you can actually help put yourself back onto a regular circadian rhythm. So looking at getting on that pattern of when you exercise, it puts you in a bit of a high, and then when you come down from that exercise, as you're relaxing, that puts you into a lower state, which then allows you to get into a sleep pattern more easily. And so this can be a really good benefit for someone that does have chronic pain. Another good quality of exercise is endorphins. So if you don't know, endorphins are a natural feel-good drug. It's a substance our body produces that helps us to improve our mood as well as improve some pain control. So when we are exercising, especially with aerobic type exercises, this can foster the release of endorphins, which will make us feel better about ourselves. Sometimes if you've exercised, you may have noticed that when you're done, you have that little bit of a high going on, that you feel just a little bit better. So we want to have that, obviously, as a benefit from exercise, but it also does work as a pain reducer. It is our own natural opioid, as it were, that helps us to reduce pain in our body. So if we can get those benefits from the exercise, that's going to help us quite a bit in our chronic pain situation. So those are just some of the regular benefits of exercise that most people will benefit from, not just individuals with chronic pain. Specifically to chronic pain, though, what exercise can also do is help to retrain the brain. And if you've watched any of the lectures or seen any live lectures on how pain is processed in the body, we know that sometimes with chronic pain, our nervous system has become sensitized, and it's not processing the pain as we'd expect it to. And what's been shown is that exercise can help to bring this nervous system back to a more normalized state. So we call this retraining the brain. So exercise can help create some new pathways. As we've had chronic pain, that can sometimes disturb some of our motor pathways, and that's how we control our movements and how we control our strength, etc. And so by working the muscles through a regular exercise routine, we can start to get those connections from the brain to the muscles normalized again, get those patterns built up. And so another thing that exercise does with the brain, it helps to reinforce safety. we know that sometimes the brain is perceiving the activities that we're doing are dangerous. Even though they're not harming the body, there's a perception that the brain has that we are hurting ourselves, which is why it rings the pain alarm. What we can do with exercise, if we choose an appropriate level of exercise, we can introduce activities at a low level, which then reinforces that this activity is safe. We do the activity, it doesn't set off the pain alarm, and then that helps to tone down that sensitized nervous system and helps to stop ringing those alarm bells. So we use exercise for that quite often. And I've kind of alluded to the last point here, and that's correct. It helps to correct movement patterns. Again, we're just getting that connection from the brain to the muscles so that we can use the muscles more efficiently, which gives us more energy and more endurance over the course of a day. Another reason we want to exercise with chronic pain is to decrease what I call secondary pain. Now, you have your pain experience. You have whatever brought on your pain symptoms in the first place. So this can be a disease process, it could be an accident or an injury that you've experienced. Something has caused your pain to become increased. Along with that, we often get what I call secondary pain. And this is pain that is caused by changing how we move. So when we are guarding a painful area, if we have a sore shoulder and we start to guard that area for a long period of time, that shoulder starts to become stiff. It starts to become locked in this new position that we're holding it. So that when we do go to use it, now it's uncomfortable. It hurts. The joint's no longer working like we'd expect it to. The joint is out of the proper positioning. The muscles around that joint are tight. So when you go to move, you have this increased pain. So that adds to your overall pain experience. So with exercise, sometimes we're not able to impact that initial cause of your pain. We may not be able to take away that process that is already in place. But by retraining us to use our body properly, we can take away this secondary pain. We can cause ourselves, we can have the benefit of freeing up the range of motion of that shoulder joint in my example, which allows us to move correctly, which then takes the pressure off of these structures and decreases the overall pain. And so this is one of the prime reasons that we like to use exercise with chronic pain, because we can have that positive impact. The number one reason that we want to add exercise to our routine is to help improve your function. And what we're talking about with function is just your ability to do the activities that you need to do on a day-to-day basis. Being able to do what you have to do. And so with chronic pain, we often start limiting our activities. We stop doing the things that we need to do. We guard up the muscles. We stop just generally doing our household chores, our work activities. We stop exercising. And all these things lead us to what we call a cycle of inactivity. And the cycle of inactivity is that we have pain, we stop moving. That stopping moving causes joint stiffness. It causes the things to become tighter. It causes us to become weaker. So when we do activities, we have an increase in pain, and it keeps going round and round and round. So what we want to try to do is interrupt that cycle. Try to get off that spiral, which is a downward spiral, which leads to less and less function overall. And we want to move ourselves towards a more functional existence. So those are all great reasons to exercise. And most people with chronic pain have been told to exercise by their healthcare provider, whether it's a physiotherapist or a physician. The problem is most people haven't been told how to be active. So they go and they try to be active, they start doing a new exercise routine, they go for a walk, they try a treadmill, but in the end, they end up increasing their symptoms. They find that their symptoms are going up, it causes a flare-up, and they're knocked out for 2 or 3 days. They try to exercise again, they overdo it, and they have another flare-up. And that pattern, repeated a few times, leads to someone not exercising. You give up on that fairly quickly. And so what we need to do is identify some ways that you can add activity to your program, add exercise to your routine that doesn't cause the flare-ups, that does reinforce that safety element, and allows you to progress through to higher functional levels. So that's what we're going to do now. I'm going to go through some tips that will help you to start adding exercise to your routine. So tip number one is you want to create a balanced program. You want to have elements in your exercise or your activity program that address all the different components of fitness. And so some of these components are aerobic activity. If you look at the research that's out there with chronic pain or conditions like fibromyalgia, most of the research recommends that we add some type of aerobic activity to our daily routine. As I mentioned earlier, aerobic activity helps to improve our endurance. It improves our ability to take oxygen in, spread it to the working muscles, which allows us to work for longer and longer periods of time. So aerobic exercise comes in a variety of forms. It can be going out for a walk or a run. It can be riding a bike. It can be taking an exercise class. It can be walking up and down hills, aquatic exercise class. There's a wide variety of options. And you just need to try to identify which one works best for you and what you can tolerate on a physical level. But that's a number one thing that we want to add. Another benefit of adding aerobic exercise, I'll go back a few slides and talk about the endorphins. Again, aerobic exercise is one of the activities that has been shown to increase the level of endorphins in our body, so we get that side benefit as well. Another component we want to add to our routine is strengthening. So we're looking at improving the ability of our muscles to perform their duties. So whether that is lifting objects, on a rare basis, or whether it's doing repetitive activities, such as stirring a pot in the kitchen, cutting up vegetables. These all involve some type of muscular strength and endurance. We want to add those components. Another part of it is core strengthening. So you hear a lot about this nowadays in the mass media, but strengthening the muscles along our spine, the muscles that provide a strong, solid foundation for all the other activities that we do. When we go to push or pull in an object, our arms and our legs need to work off of something stable, and that becomes the trunk. And so this plays a key role in helping us to improve our function when we do have chronic pain. Core strengthening also plays a huge role in posture. And we know with pain, we often change our posture to what we call the pain posture. And the pain posture is often that head forward, shoulders slumped forward posture that we get into a kind of a fetal position that just feels good when we're in pain. Well, after a period of time, the pain posture becomes your posture, and then that leads to all sorts of functional changes and that increased secondary pain that we talked about earlier. So strength and endurance is another important part of a balanced program. We also want to add in flexibility. Again, to remove some of that muscle tightness and tension. When we're in pain, we have a lot of tension in our muscles. We start to get in that constricted, contracted state. And so if we can find some ways to loosen that up, let the muscles to move more freely, again, that's going to be helpful to us. So those are some of the things that we think of when we think about adding exercise routine. And these are kind of things that we often associate with going to a gym. But it's not necessary that you have to go to a gym to do these things. All of these things can be worked on in the home. They can be worked on with very basic equipment, things you can find around the house. So I don't want you to get caught up in thinking that you have to go and get the structured program at a local facility. You can do these things at home. If you choose to go to a local facility, that's fine, but you need to find out what's going to work best for you. Now, along with these basic things, some other things you can add to your program are just some other general activities. What's really popular nowadays is yoga. Yoga is a great activity to improve endurance, strength, and flexibility all at the same time, and also core strengthening. And there's various programs out there that are geared towards individuals with pain. Just look in the directory to find various yoga facilities that can provide those services. Other activities such as Tai Chi or Qigong. Again, nice relaxed activities, low impact activities that really, again, work on that muscular endurance component as well as the flexibility. So there are a lot of different options out there. Now, in addition to just strictly exercise programs or exercise classes, I also want you to consider just your day-to-day activities. So doing things like gardening, like doing yard work, even housework, even though it's not enjoyable for a lot of people, all these things can be a part of a regular exercise or activity routine. Looking at the hobbies that you do. Are there things that do require you to use your muscles and to move around? Incorporate this into that balanced program. It's not all about just specific exercises. It's about movement in general. You want to get back to doing the things that you need to do. And so when you create a new program, try to encompass a variety of these things in that routine. And a key part with whatever you choose to use is you need to start low and go slow. We don't want to just jump right into something you haven't done before because we know what the consequences will usually be, and that is an increase in symptoms or pain. So we're going to talk about that a little bit later, about how to find out how low to start and how slow to go. Tip number 2 that I have for you today is pick some exercises or activities that you enjoy. As a kinesiologist, I prescribe exercises to people on a daily basis. And if I prescribe something that someone hates, that they do not enjoy, I know they will not do it. They may do it for me a couple times, but in a few weeks' time when I follow up, they'll say, no, I didn't really do that. It wasn't something I was interested in. And so you need to find things that are interesting to you and things that you have some enjoyment in doing. And this all comes down to consistency. when we start adding exercise to our routine, we want to stay consistent with it. The more consistent we stay with our exercise, the more of those health benefits I talked about earlier that we're going to achieve. Tip number 3 is that you need to plan for good day workouts and exercise and bad day workouts and exercise. We know with chronic pain, it's an up and down pattern sometimes of good days where you have high energy and low pain, and bad days where you have low energy and high pain. And as I just mentioned, consistency is a key part of getting into an exercise routine to get the health benefits. Now, when we have this up and down pattern of good days and bad days, it's often hard to stay active on those bad days. And if you have a few bad days in a row, it really makes it difficult to get back into the groove of exercise when you have that good day again. And so what I see quite often is people have good intentions. They want to try to get into an exercise routine. They start exercising when they're feeling good. A flare-up comes or a low energy time period comes. They're knocked out for a few days, and then they struggle to get back into that exercise routine. And so what we're really talking about here is pacing. And so for more detailed information on pacing, I recommend that you watch the pacing lecture that's available through the Chronic Pain Center as well. But on a real general level, what I'm talking about here is that on high energy, low pain days, you do your regular workout. So this will be the workout that includes the majority of the exercises that you do. So you may have that cardiovascular component, you're doing some kind of aerobic activity, you have a few strengthening exercises, including your core strengthening, and you have your flexibility. So you're kind of doing that well-rounded program. On a low energy or high pain day, what we want to do then is back off from that a little bit, because it's probably going to be a little bit too difficult to do all of those activities. So a low energy day or a high pain day may have some very light aerobic at a shorter duration. So instead of doing your regular 30-minute walk, maybe you're doing a 10 to 15-minute walk. And then you're finishing that off with some really gentle stretching. So that's something that keeps you going. It keeps you in the routine of exercise. It keeps that habit building, and allows you to stay active despite that pain flare-up occurring. Now, there's a lot more detail you can get on that. Like I said, the pacing lecture is a great place to grab that information. But be aware that you need to have these different workouts available to you. And I find it works quite well with the population that I work with. Tip number 4 is breathe. And this is sometimes counterintuitive to what we think with exercise. Oftentimes when we start exercising, we think that you need to hype yourself up. You need to get warmed up and worked up, get that heart rate up, breathing rate up. And that's true to some degree, but what we know with chronic pain is that we're often in a hyped up state to begin with. And what we call that is the sympathetic nervous system state. And that's the state that we're in when we're in our fight or flight mode. So when we're scared or when we're angry, we're in this state where we have shallow breathing, our muscles are tense and tight, we're ready to just either punch somebody or run away to save ourselves. We're in this hyped up state, and that state causes us to have a lot of stress in our bodies, which leads to decreased endurance because those muscles are always tense. So they start to fatigue after a while, and we can't sustain our activities as long as we need to. So what we want to try to do, if you're exercising and you are experiencing chronic pain, is try to get ourselves out of that sympathetic nervous system state and into more of what we call the parasympathetic nervous system state, which is our rest and digest mode. So what we're trying to do here is to get rid of some of that excess tension that we have, both the mental tension and the physical tension that we have, and get those muscles to be in a more relaxed state. What this does is that when we start to exercise, the muscles are starting from a more relaxed state, so they can perform those exercises in an easier fashion. They're not already in the fatigue state, so they can last longer. They can do more of the actual activities that we want to try to do. And so, by practicing some deep breathing strategies prior to the exercises and during your exercise routine can really help to make that exercise experience a more enjoyable and relaxed one. Another thing that deep breathing does with exercise is it reinforces safety. We talked a little bit before about how chronic pain is often a result of a sensitized nervous system, and a nervous system that is giving us the wrong message when it comes to the activities that we're performing. It's telling us that the activities are dangerous, that we're harming ourselves, but in reality we're not. And so what's been shown is that by using deep breathing and relaxation techniques, we can shift that emphasis away from that danger message to more of a safety message. And we start to train that brain that this is okay, this is all right. We don't have to ring the alarm bells. We're able to do it and carry on as we naturally would. So I really encourage you to start using the deep breathing as part of your workout routine. The last tip I'm going to work on today is establishing a starting point. And so this is going back to that start low and go slow comment on an earlier slide. What we're looking at here is trying to find what level of exercise can you start at. As I mentioned earlier, oftentimes people start an exercise routine and they end up doing too much. They'll end up flaring themselves up. They have an increased level of muscle soreness, joint soreness, or just overall symptom soreness. And over a period of time, that leads to them stopping an exercise routine. What we need to do is find out how much exercise can you tolerate right now. Where is an appropriate starting point that's not going to cause this flare-up, that's not going to cause this uncomfortable experience that you've had in the past. So what we're going to do is we're going to find your limits and we're going to try to stay within those limits. And there's a couple of approaches that people use with activity in general. And one of these is a push-through approach, or do it no matter what approach. And this is an approach where you just do as much as you can. And this often leads to that flare-up because you have done too much in terms of what your body is tolerating or your nervous system is tolerating. The opposite approach to that is the wait until approach. And this is when you just kind of hang back and you'll do activity when you feel a little bit better, when the pain starts to go down. And both of these approaches may lead to an increase in sensitivity of the nervous system. They may lead to further ramping up of this nervous system that is getting the pain response wrong. Again, this is discussed in detail in the pacing lecture, so if you'd like more information on the different approaches to activity, I recommend that you go there. But in general, when we look at both of these approaches, this is what we have. So this line here is what you see with the push-through or the do no matter what approach. What you have here is a person doing a lot of activity, and they're exceeding their tolerance line. And I'm going to talk about tolerance right away, but this is a line where you start to perceive that that exercise is starting to cause an increase in your symptoms. So with this first approach, the person's pushing through that tolerance line, coming down and crashing a little bit. They push through again and they crash. They push through and they crash. Over time, it's a downward projection as far as your function. The amount of things that you're able to do becomes less and less and less because you're sensitizing things even further. This second line here is the wait until approach line. Here you're not doing your activity. You're waiting to perform the activities because you have that higher level of pain. You just want to try to let it go away. But over time now you're not doing the things that you need to do. And there's a slow decline in your physical conditioning. You have less function because now you have increased weakness. You have less endurance, etc. So what we want to do is avoid using these two approaches. So what we need to do is find out where we need to be. And finding that right point to start your exercise can be a very fine line. It's a fine line between doing too much and doing too little. And it does take a little bit of work on your part. So I'm going to give you a little bit of a formula here to help you to establish what we call your tolerance and your baseline. So coming back to the term I used earlier, and that's tolerance. So tolerance is the amount of time or the amount of repetitions that you can perform an activity until there is a noticeable increase in your pain. Or you're perceiving that there's going to be a negative effect to performing this activity. And what we call noticeable, I mean, this is a very subjective thing. If we're using the pain scale that says 0 is no pain, 10 is the worst pain you've experienced, you know, a 1 to 2 point jump on that pain scale is usually enough to let us know that, yes, something is ramping up. So if you start an exercise and you start off at a 5 out of 10, you start doing the exercise after a period of time. After 20 minutes, you notice that pain has jumped up from a 5 to a 7. That's a noticeable increase in pain, and that's a signal to you that you have reached that tolerance. You've reached the point where your body is saying, we don't want to do this activity anymore. We're perceiving it's dangerous, or things are starting to get ramped up on a symptom level. So that's what our tolerance is. So we need to establish what exactly the tolerance is for the activities that you are choosing to perform. And this can be done with any of the things that I mentioned earlier. It can be with aerobic activity, it can be with your resistance training, it can be with your ability to perform an exercise class, or your day-to-day household chores. You need to find out how much of these activities you can do before you have this noticeable increase in pain. So to do this, before you start an activity, you take note of where you're starting on the pain scale. Are you starting at a 3? Are you starting at a 5 or a 7? Note the time that you start the activity, and then you start performing the activity. As you're doing the activity, what you do is you check in with yourself periodically to see, where am I at? Now, I don't recommend that you sit there and every single minute and every single second think, okay, my pain's at a 1, my pain's at a 2, my 2.5, 2.5, 3, 3. It's not an auction. We don't want to be doing that. We want to just periodically check in and see, is that starting to ramp up, or am I staying on a kind of a plateau? So you start doing the activity, you take those little check-in points. When you notice you've had that 1 to 2 point jump increase on the pain scale, note the time of that, and that's the duration of the activity that you can perform until you've reached that tolerance level. Why do we use 1 to 2 points? 1 to 2 points has been shown that to be a level that, if we stay within that range, we can try to prevent the delayed onset of pain later. Oftentimes when you do an activity and you have that increase of pain, if you start pushing through, if you do too much, that pain is going to persist for a long period of time. So what we're trying to do is stop before we get to the point where it is going to be a long delayed process for that pain to be experienced. What we also tell people is that depending on where you start is going to determine whether we're going to use a 1 or a 2 point jump on the pain scale. If you're starting at a 6 or above on the 10-point pain scale, you're already at quite a high level of pain. Probably a 1 point jump is all it's going to take to make that noticeable. That's all it's going to take to say, yes, you know what, things are starting to ramp up, because you're already quite high. If you're starting at a 5 or below, probably a 2 point jump is what it's going to take for it to be noticeable, because you're starting at that lower level. And again, this is all subjective. Different people are going to feel differently about their activities. Different people are going to have different tolerances, but use what is best for you. This is not compared to anybody else. It is simply how you feel on this pain scale. If you're someone who doesn't like using the pain scale, or that just annoys you, as a lot of patients express to me when I work with them, we can also look at it just from more of a feeling sense about how you feel about the activity and and the feedback that your body's giving you with the activity. And so as you notice your symptoms changing, as you notice there might be a slight increase in symptoms, or you notice more things are starting to ache, you need to start asking yourself, am I safe to continue with this activity? And what we mean by that is, do you feel you can continue to do the activity without experiencing this large flare-up of pain symptoms? And so if you think, if the answer to the question is yes, I'm safe, and I'm not damaging myself, I'm not harming myself, ask yourself, if I continue, am I likely to have a delayed flare-up? So if I continue doing what I'm doing, are my symptoms going to continue to increase to the point where I'm not going to be able to function like I want to? And so the question I often get my patients to answer is, if I continue, can I do the things I want to do tonight and tomorrow that I have planned? And if the answer is no, I can't do that, that's a pretty good sign that you need to stop, that you've reached that tolerance point. If you think that if you carry on with this activity, you're not going to be able to function like you have planned, that's a good sign to stop at that point. And so, whether you use the pain scale, the 0 to 10 pain scale, or whether you use just that intuition, that feeling that you have, whatever works for you, you just need to have an awareness of where is that point where this is going to become something that's going to hamper my ability to function. Now, it's really easy to determine tolerance when you experience pain at the time you do the activity. However, for a few individuals, you don't feel the pain at the time you do the activity. You do feel it after. You do have that delayed pain. So you go out and you do your walk, and it feels fine. You go for that half an hour, everything feels great, but then, a few hours later, your symptoms start to go up. You start to have the increased ache in your back or the increased ache in your legs, and it sticks around for a little bit longer at that point. So then it's hard to really judge how much can I do. So we still use the same process, it just takes a little bit longer. So instead of having the immediate feedback that we have a 1 to 2 point jump on the pain scale, we're going to have that delayed response. So what you do is you do the activity that you have planned, you stop at your regular starting point, or you choose just an arbitrary starting point. So I'm going to say I'm going to try 20 minutes. After that 20 minutes, you take note of that. Then over the next 24 or 48 hour period, you monitor what happened with your symptoms. Now to do this, it's really helpful to have a pretty consistent day. Because if you're doing a lot of different things in one day, it's going to be hard to pinpoint what caused that delayed increase in pain or that increase in the point scale. So when you are trying to establish your tolerance and baseline, try to make it a consistent day. Do the activity, take note of how long you went, and then monitor and see if you have the increase in pain. If you did have that increase in pain, look at lowering it to a lower level the next time, and then you monitor again. If you didn't have that increase in pain, you slowly work your way up, trying to find where is that point where you have your tolerance. So it's a little bit more of a delayed process, but you still can do it. When you're trying to establish your tolerance, it's good to try doing this on different days of the week, on a few different days. Because again, we know the pattern with chronic pain is up and down. We know that you're going to have some good days and some bad days. You're going to have days where you've maybe done more during the day prior to doing your exercise or your activity. And so we want to try to get an idea of what the overall average is for a tolerance. So what we have you do is try to find your tolerance on at least 3 different days of the week. So maybe a Monday, a Thursday, a Sunday, whatever you want it to be. Find out what those tolerances are, and then take an average. So if it was 17 minutes, 20 minutes, 23 minutes, average it out, it's going to be 20 minutes. And that's going to give us a rough idea, because it is going to change over time. It's not always going to be consistent. It's not always that you get to 20 minutes and that's it, your exercise is over. Some days you're going to be able to go longer, some days you're going to be able to do a little bit less. But try to find that average. Now, once you have established that tolerance, what we want to do is back off to what we call a baseline. So if we know at the tolerance line is when we're starting to set off our symptoms, that's when we're starting to ramp things up. That's when we're starting to set off the alarm bells. We don't want to do that all the time. A continued pattern of always going to your tolerance line or going beyond your tolerance line, what that leads to is establishing a pattern that this activity equals pain. So if every time you go for your walk, you cause an increase in pain, the connection that your brain's going to make is walking equals pain. So we want to get away from that because we want to reintroduce the element of safety to our activities. So what we need to do is back away from the tolerance line to a point where we're not setting off the alarm bells, to a point where we do the activity, we complete it, and we're still feeling okay. We're still feeling all right. And then that leads to the connection being made, this activity is safe. This is something that I can do on the long term, and the alarm bells can maybe stop ringing. And so what we have you do is back off, and on the slide here, we talk about backing off to 50%. Backing off an activity about 50% is probably going to ensure that you are coming away from that tolerance line enough that you have some room to play. And that can be quite difficult for individuals to do. If you've worked hard to get up to 20 minutes on a walk, and now I tell you to go back to 10 minutes, I can sometimes get a lot of resistance with that, but we have to think about the long term. What we're trying to do is get this activity to be safe, perceived as being safe, and what we're going to do is over time is slowly build that back up. So again, using that pacing strategy. So we back off to a safe level, we're going to start there, we're introducing the element of safety, and then we're going to increase gradually. And so by gradual, I'm talking about a 10% increase. So a lot of times people will, back off to 10 minutes, and then they'll jump right back up to 15 minutes, and then back up in 20 minutes in a couple sessions. We haven't given ourselves enough time to adapt to this new exercise intensity. So we recommend small increases. 10 minutes, as the example was, you back off to 10 minutes. After I always say 3 to 5 sessions. See how it's feeling. If it's going okay, increase 10%. Keep it there, 3 to 5 sessions. If it's going okay, increase 10%. And gradually progress that way. And so what we're doing is we're just allowing the body time to adapt, allowing that nervous system and brain time to adapt to these new levels of intensity, the new levels of duration that we have with the exercise. And what we see with this is that we actually improve our function over time. Whereas the other approaches where you do too much and do too little, there's often a decline in your function. With this approach, we often see that we now surpass that previous tolerance line. We actually start seeing ourselves going above it and still not ringing the alarm bells. It does take a little bit of time, but I have seen it work in a variety of situations with the patients that I work with. So just going over the example again, if you backed off to a walk of 10 minutes, you do that 3 times per week, you increase by a minute. So it's a very small increase that we're doing. And you do 11 minutes for the next 3 times, and you carry on from there. So it is a little bit slow, it is a little bit methodical, but there's a purpose to it. There's a purpose to improve function overall. We're backing off initially to get ahead in the end. So, in conclusion, basically what I've discussed today is that exercise is an essential part of a pain management strategy. It goes along with all the other things that you may trial, such as medications and self-coping strategies and pacing and all these types of things. It does play an important role. The key thing is that you need to find some activities that you enjoy, something that you will stick with, that you are going to continue on with, because the consistency is key to actually get the physiological and the neurological changes that we want to happen with the exercise. Key point though, and the point I spent the most time on today, is that you need to establish your exercise tolerance and your baseline levels. You need to find out where you are going to start the exercise so that you're not setting off the flare-up, so you're not setting yourself up for failure in these endeavors that you're going to pursue. So find out where you're going to start, but we are going to progress from there. We are going to move up. And so start low and go slow. So I wish you luck with your exercise routines. I will recommend that if you have specific questions regarding exercise, that you do consult an exercise professional, whether that's a kinesiologist, occupational therapist, or a physiotherapist. Consult with them and they can give you further guidance.